Everyone assumes that turning 65 means your healthcare worries are over. Medicare kicks in, retirement starts, and supposedly everything gets easier. Except the average 65-year-old couple will spend $345,000 on medical expenses throughout retirement. That's not including long-term care. Most people think they'll need maybe $75,000 total. They're off by $250,000. You've probably seen the commercials. Medicare covers everything, right? Hospital stays, doctor visits, preventive care. What they don't mention is what Medicare doesn't cover. Dental care, vision care, hearing aids, and the big one that bankrupts people, long-term care. You know what else? Even with Medicare, you're still paying premiums, deductibles, copays, and coinsurance on everything it does cover. Let me show you what this actually looks like. In 2026, your standard Part B premium is $202.90 every month. That's just the premium. You'll also pay a $283 annual deductible before coverage even starts. Then there's the coinsurance, which is 20% of every Medicare-approved service. If you need a hospital stay, add a $1,736 deductible per benefit period. And here's the part that makes people's eyes water. There's no yearly limit on what you pay out of pocket with original Medicare unless you buy supplemental coverage. Most people hear those numbers and think, okay, that's manageable. A couple $100s a month, some deductibles, I can handle that. But watch what happens over time. For a healthy 65-year-old couple, total annual healthcare costs start at $17,003 in the first year of retirement. By age 85, that number climbs to $55,513 per year. Same people, just older. The national average lifetime premiums for traditional Medicare options are projected at $688,996 for a couple retiring in 2026. When you add deductibles, copays, hearing, vision, and dental, you're looking at $955,411 total, nearly $1 million. And remember, that still doesn't include long-term care. Here's what nobody talks about. Healthcare costs are climbing at more than twice the rate of Social Security cost of living adjustments. Your Social Security might go up 2% next year. Your healthcare costs, they're going up 5% or more. Every year, your purchasing power shrinks. Out-of-pocket healthcare costs already eat up roughly a third of a typical retiree's Social Security income. For many people, it's closer to half. Women face an even tougher reality. A healthy 65-year-old woman could face $313,000 in total healthcare expenses over her retirement, compared to about $275,000. For a man, longer life expectancy means more years of medical costs. It's not fair, but it's math. The brutal part is how many people completely underestimate this. When surveyed, retirees said they expected to spend about $2,700 per year on routine healthcare at age 65. The actual number from the Bureau of Labor Statistics is close to $6,500 per person. That's $13,000 for a married couple. People are off by a factor of 5 on their annual estimates and missing the reality by hundreds of thousands over a lifetime. You might be thinking Medicare Part D covers prescriptions, so at least that's handled. In 2026, annual out-of-pocket Part D costs increased to $2,100. The maximum deductible is $615, and about 20% of consumers skip or ration their prescriptions because of high costs. When you're living on a fixed income and choosing between medication and groceries, that Medicare coverage doesn't feel quite as comprehensive anymore. But there's something even more expensive lurking in retirement that most people don't see coming until it's too late: long-term care. Nearly 70% of people over 65 will need some form of extended assistance: nursing home, assisted living, in-home care, and Medicare covers almost none of it. The median cost of a private room in a nursing home is $376 per day in 2026. That's $11,294 per month, or $135,528 annually. For a semi-private room, you're looking at $328 per day, which is $9,842 monthly, or $117,904 per year. Assisted living is slightly cheaper at $6,200 per month, but that's still $74,400 annually. If this opened your eyes to what life after 65 really costs, hit like so more people don't get blindsided by this, and subscribe for straight-up, no-nonsense breakdowns that help you stay ahead financially and make smarter money decisions. Medicare will cover the first 20 days of a nursing home stay completely. Days 21 through 100, you pay $217 per day out of pocket while Medicare covers the rest. After 100 days, Medicare pays nothing. You're on your own. According to Milliman's 2025 Long-Term Care Index, the projected average lifetime cost of formal long-term care for a 65-year-old is about $135,000. Women face roughly $171,000 because they live longer. Men average about $98,000. Long-term care insurance exists, but it's expensive. Annual premiums for a healthy 60-year-old average $2,610 for men and $4,550 for women. Those premiums grow 3% annually. Over 20 years, you could pay over $100,000 in premiums. But 1 year in a nursing home costs $129,575. The math says insurance might be worth it, but most people never buy it because the premiums feel impossibly high when you're healthy. Here's what makes this catastrophic. Most retirement planning focuses on living expenses, travel, maybe some health care. Almost nobody budgets for 3 years in assisted living at $74,400 annually. That's $223,200 that could obliterate a retirement account that took 40 years to build. And we haven't even talked about what happens if you retire before 65. The gap between early retirement and Medicare eligibility is a financial minefield most people stumble into blind. Without subsidies, ACA marketplace premiums for a 62-year-old run $1,000 to $1,800 per month in 2026. That's the full price. Federal subsidies cut off above 400% of the federal poverty level, which is roughly $62,600 for a single person. If you're drawing from investment accounts in early retirement, you can easily exceed that threshold. Your premiums double overnight. If you retire at 60 instead of 65, you'll pay approximately 56% more for healthcare expenses than if you wait until Medicare kicks in. Approximately 1/3 of people who claim Social Security at 62 do it specifically to cover health insurance until Medicare starts. The 5-year gap between 60 and 65 can cost $100,000 or more in health insurance alone. That's before you pay a single deductible or copay. Beyond healthcare, retirement has hidden costs that rarely appear in financial planning calculators. Adults 65 and older spend an average of $21,445 annually on housing, even though 53% are homeowners with no mortgage. Property taxes, insurance, utilities, maintenance. They don't stop when the mortgage does. Transportation averages $9,033 per year. Federal income taxes average $4,343. State and local taxes add another $929, and roughly 43% of retirees report being more financially stressed during retirement than before it, primarily because of unexpected expenses they never saw coming. Some retirees end up helping adult children through crises at up to $20,000 per year. Others pay college tuition for grandchildren at $50,000 annually. These aren't planned expenses. They're financial ambushes that drain retirement accounts faster than any calculator predicted. Inflation makes everything worse. $50,000 in annual spending today will need to be $90,000 in 20 years just to maintain the same lifestyle. The gap between what people think retirement costs and what it actually costs is staggering, and healthcare is where that gap becomes a chasm that swallows financial security whole. The reality is this: most people arrive at 65 with maybe half of what they'll actually need for healthcare alone. They've planned for groceries and utilities, maybe a vacation or two. Nobody planned for $955,000 in medical expenses. Nobody budgeted for 3 years in a nursing home. The retirement you're picturing and the retirement you can actually afford are two completely different futures. Start calculating the real numbers now, or spend your retirement watching your savings evaporate while you're still healthy enough to notice.